all right. Thank you very much for coming out this evening. I realize we had a great debate, those of us who are organizing this, as to whether or not to do it. We said the issue was urgent enough, it was trying, so we do have a decent crowd, and I thank you for your commitment. So tonight, I think you all know this, but we're going to discuss vaccine hesitancy. We've been sponsored by the Brookline Department of Public Health and Human Services and their adjunct organization, Friends of Brookline Health, as well as various regional Brookline Rotary clubs. Brookline, Needham, Cambridge, anybody's here from Cambridge? I think there is Cambridge. Another great example of Rotary actually supporting itself. Were this a better night, we would have had a bigger crowd of people from other towns as well. Anyway, we have two speakers tonight. They're both very good. I know them both a little bit by now. The first one is Motta, right here to my left. I'm reading his description of who he is. He is a PhD. He's an assistant professor of health law, policy, and management at BU School of Public Health. And the second speaker is Rosemarie Roque Gordon, who's a pediatrician and primary care provider at MIT Health. She's also a member of Brookline's Public Health Advisory Council. So I think we'll have a good evening. We're going to speak, the speakers that I've asked to speak for 20 minutes apiece, followed by a half an hour of questions and answers. Thanks. I look forward to the evening. So
yeah, thank you. So I've got two microphones here, right? So this one will be for that, and this one will be for the room. Okay, great. Well, thanks so much for braving this freezing summer evening and being here tonight. Really happy that we can chat about this really important topic, thinking about vaccine hesitancy from a global perspective. Not just global, right, with respect to national borders, but global with respect to the way that we think about the causes and consequences of what this thing is, vaccine hesitancy. And that's what I want to talk about tonight. The prevalence and health policy consequences of vaccine hesitancy in the United States and abroad. How many people are vaccine hesitant? What do those views do when it comes to public health? That's what I want to unpack in a little bit more detail tonight. And then Dr. Roque Gordon will later on tell you about some of the strategies for combating vaccine hesitancy in clinical practice. But before I can tell you about what vaccine hesitancy does and why it's important and why I think we should care about it, I think we first need to define what vaccine hesitancy is. And so if you'll permit me, what I've done here is put up on the screen kind of a continuum that I think is useful for thinking about vaccine hesitancy. Because for most of us who are scholars in this literature, we tend to think about vaccine hesitancy not as a dichotomous category. You're a vaccine skeptic or you're not. You're anti-vax or you're not. For most people, vaccine hesitancy represents something of a continuum, from outright refusal, saying I'm not going to vaccinate under any circumstance, to outright acceptance. I get all the vaccines that are required of me when I ought to do so. And for many people who hold vaccine hesitant views, they fall somewhere in between those two extremes. These are the people who say, I'm not anti-vaccine, but I think that kids get too many vaccines in childhood. Maybe we should space them out a little bit. Or maybe I'm going to skip the Hep B vaccine. I'll come back to it later on. This is usually what we're referring to when we talk about vaccine hesitancy. And as you'll see as I go through some of these slides, the number of outright refusers, people who refuse to vaccinate, is relatively small in contrast to the number of people who say, I want to delay or not get some vaccines for either myself or my kids. And I think it's really important to contextualize where contemporary vaccine hesitancy comes from. And I apologize if these figures are a little bit blurry or hard to read. I'll explain exactly what you need to know, which is on the slide. Which is that I think that a fraudulent study published by since revoked Dr. Andrew Wakefield, alleging a link between the MMR vaccine and the onset of autism in children, has a lot to do with contemporary vaccine hesitancy, at least in the United States, although I think there is also some evidence that it has spilled over, shaped the way that people think about vaccines abroad. Now, it's really hard to know what impact this study had on vaccine hesitancy, because at the time that it was published in winter 1998, we didn't know, we meaning public opinion professionals, I'm someone who does public opinion research, we didn't know that we should have been polling the public about vaccines. We didn't know that vaccines were controversial. And so there is a kind of lack of data telling us what it is the public thought about vaccines in the early to mid 1990s. So what my colleague Dom Stecula and I did was we tracked adverse event reports to the vaccine adverse event reporting system, which is basically, if any of you got COVID-19 vaccinated, which I suppose many of you in a crowd talking about vaccine hesitancy have, if you look at the back of that card, you have the opportunity to log adverse events with the federal government, with HHS. That system can serve as a kind of smoke alarm or a warning sign that there may be an issue with vaccines with respect to safety. But what we've seen in the vaccine adverse event reporting data is that prior to Andrew Wakefield's study, if you look here at the left-hand side of the screen, panel A, x-axis is time, y-axis is the number of reports that are logged to VAERS, you see that from 1990 till about 1998, which is when that study comes out, the number of vaccine adverse event reports are relatively constant, right? People are thinking about vaccines in a relatively similar way. They're logging adverse event reports in a relatively similar way. And the vaccine itself has not changed since 1990. But what does change is the vaccine communication environment. And in 1998, when that paper is published, we see a multi-time increase in the number of adverse event reports logged to VAERS. And what that to us demonstrates is that the genesis of contemporary vaccine hesitancy, at least in the United States, may owe itself back to this fraudulent paper and the media attention that was given to it. And the attention that is given to fraudulent studies and vaccine skepticism will be a theme I suspect we will return to throughout our time together tonight. But there's been another accelerating event that I think is critically important for us to understand in talking about vaccine hesitancy, which is that the COVID-19 pandemic fundamentally changed the way that Americans think about vaccines, vaccine safety, and vaccine efficacy. And here's what I mean by that. So my colleagues and I have done research for a long time. Believe it or not, we were studying the politicization of vaccine hesitancy long before the COVID-19 pandemic, years before. And what I and some of my colleagues have shown in some of the research that we've done is that Democrats and Republicans thought about the MMR vaccine, measles, mumps, and rubella, quite a bit differently before the COVID-19 pandemic. Republicans were less likely to want to vaccinate their kids. Democrats were a bit more likely to want to do so. So the COVID-19 pandemic is one in which Democrats and Republicans are already holding differing opinions about vaccine safety and efficacy. But amazingly, at the start of the COVID-19 pandemic, if you look at the red and blue lines of this figure, it's a number of Democrats in blue, Republicans in red, who wanted to vaccinate against COVID-19 before a vaccine became available. And at the start of the pandemic, I published research showing that Democrats and Republicans were pretty similar with respect to whether or not they wanted to vaccinate. And this to me was extraordinary and not what I expected, based on the research suggesting that Republicans and Democrats thought about vaccines in different ways prior to the COVID-19 pandemic. But look, a lot of us wanted to get out of our house. A lot of us wanted to resume life as usual. And so Democrats and Republicans thought about vaccines in a very similar way. But something changed. The vaccine communication environment, just like it did following the publication of Andrew Wakefield's paper, changed once again when President Trump made a concerted effort to downplay the severity of the COVID-19 pandemic. Why would you choose to vaccinate against an infectious disease if that infectious disease isn't a big deal, right? Vaccinating is a logistical hurdle. You have to go sign up to get vaccinated. You have to go to a pharmacy or go see your doctor, right? Who's going to voluntarily sign up to do that if you don't think the disease is all that important? And what we saw throughout the course of the COVID-19 pandemic was a dwindling on the ideological right of folks being willing to vaccinate. Now, interestingly, as the pandemic wore on, we saw a little bit of a switch between Republicans and Democrats, and that change coincided to a vice presidential debate wherein Kamala Harris, who at the time was debating against Mike Pence, if you remember that debate back in 2020, suggested that she wasn't necessarily sure if she would get a COVID-19 vaccine that was approved by a Trump administration. And this actually had a pretty calamitous impact on public opinion. But after Biden won the presidency in 2020, public opinion rebounded on the left. Suffice it to say, the COVID-19 pandemic could have been an opportunity for Democrats and Republicans to come together on vaccine-related issues. And indeed, in its initial weeks, it was. But that changed when the communication environment changed. And that has a lot to do not with public health, but our politics and the intersection of those two things. And my colleagues and I, I'm not going to go through all of the numbers here, but we've tried to unpack, okay, what was it about the communication environment that changed? We've attributed a lot of this to the coverage of President Trump's remarks on cable news and other outlets, the spread of misinformation. I'm happy to unpack all of these possibilities in Q&A, but what I really want to draw attention to is that vaccine hesitancy isn't just some abstract thing that we're interested in talking about on a very cold summer evening in the library, right? It's something that has very real world consequences for people, because the partisan divide in vaccine hesitancy that existed before COVID-19 and has gotten worse since COVID-19 has created unequal health outcomes on the basis of people's partisanship. I've shown, for example, in published research that we've seen more reports of adverse events resulting from non-COVID-19 vaccines on the ideological right following the COVID-19 pandemic, which is essentially an indicator that Republicans have grown more hostile toward all forms of vaccination. And of course, this isn't all Republicans, right? We all know Republicans who choose to vaccinate regularly. But this is a general tendency that we've seen in the aftermath of COVID-19. And heartbreakingly, we've seen partisan asymmetries not just in vaccine uptake, but in people's experiences with infectious disease and the infectious disease burden. We've seen, for example, asymmetries between counties that voted for Joe Biden in 2020 and counties that voted for Donald Trump in 2020 with respect to the percentage of that county that chose to vaccinate against COVID-19. I'm not even sure I need to explain this figure because the very stark relief there that you see between the blue and the red dots, I think, kind of tells you exactly what's going on here. But there is something I need to unpack, which is what we refer to in our literature as a COVID-19 vaccine spillover effect. This is a term that my colleagues and I have used to kind of popularize the idea that COVID-19 vaccines have fundamentally changed the game. That the way that people feel about COVID-19 has changed the way that they feel about seasonal flu shots. If you're the type of person who came to hold more negative attitudes about COVID-19, you also came to hold more negative attitudes toward getting your seasonal flu shot, toward childhood vaccines like MMR, and towards vaccines that don't even exist yet. I've published research showing that a hypothetical cure for cancer is already polarized along partisan lines simply because it uses mRNA technology and because that technology has been tied to Democrats in the past. Again, happy to unpack all of those things in Q&A, especially this cancer one. That's one that I think is getting kind of a lot of interest right now, given some of the cuts that we've seen coming from the federal government for cancer-related research. But I wanted to draw attention to this idea of mRNA vaccine stigmatization that I talked about before. We have seen policy efforts across the states to ban mRNA vaccination in states like Idaho and Montana. We've seen efforts to stigmatize mRNA vaccination by labeling mRNA vaccinated food, like pork products that have received mRNA vaccines, to label mRNA vaccinated people who donate blood in order to give people who are receiving blood the choice to either receive or not receive blood that comes from mRNA vaccinated people. And what my colleagues and I, in partnership with the Rhode Island Department of Health, have documented in some of our ongoing research is that Democrats and Republicans feel very differently about mRNA vaccines. Democrats tend to hold more positive views, and Republicans tend to hold more negative views about mRNA safety and efficacy. We've seen similar results with respect to RSV vaccination, both for older adult populations, and my colleague Tim Callahan, who's a professor with me at BU, has shown as well for infants and for pregnant persons as well. And I swear to God, I'm not making this up, that COVID-19 has changed the way that we think about vaccinating our pets. Probably the proudest moment of my professional career was having Michael Che on SNL tell a joke about our research, wherein we showed that people who hold negative views toward the COVID-19 vaccine are less likely to want to vaccinate their pets for fear that their pets might, and again, I'm not making this up, get pautism. Now, pautism was not the word we used, but that was the word that Michael Che used in this bit on SNL, right? But the idea here is one that we see across every type of vaccine, that COVID-19 vaccination has fundamentally changed the game. And I think we have a power out of some kind. No,
Darlene will rescue us here.
Matt, another 5 minutes, 6 minutes?
Sure, yeah, I can wrap up. So the other thing I wanted to make sure I said before I wrapped up today is that the reason why we care about vaccine hesitancy is not just because of the unequal, this is great, yeah, thank you. Not just because it's a public health problem, but it's also a policy problem. So many of you have asked questions, I heard lead up to this event, have asked questions about what RFK Jr. can and cannot do in his role as HHS secretary. RFK Jr. cannot take away the polio vaccine from your kids. That is not under his discretion as HHS secretary. I'm a health policy professor. I am happy to unpack the legal specifics later on if you'd like. We're not going to get into it now. But suffice it to say that this is a power that is constitutionally reserved for the states. And that's why every state has different recommendations as to what students need to do in order to attend public schools, which vaccines they need to receive. You can see up here on the board a smattering of different policies across the 50 states regarding vaccine eligibility. RFK Jr. cannot take away the polio vaccine, but he can give vaccine skepticism a megaphone, and that's precisely what he's doing right now. Think about water fluoridation. How many of you were talking about water fluoridation at the dinner table 10 years ago? People who are on public health committees cannot raise their hand here. But everybody else, right? Who was talking about this at the dinner table? Most of us weren't. And yet recent polling suggests that Democrats and Republicans now have vastly different views on whether or not they think fluoride should be put in drinking water. This, of course, has been a major talking point coming from Kennedy for many years, and now we're starting to see states follow suit. We've seen Utah ban fluoride in drinking water. We have seen Florida propose similar legislation. And in fact, there is legislation right here in Massachusetts that would propose to do the same. I hope it's going nowhere, right? But certainly it has at least been proposed. This is why we care about vaccine hesitancy. It's a public health problem and it's a policy problem, because when RFK Jr. gives vaccine skepticism a megaphone, states follow suit. The people who do have the opportunity to make these changes follow suit. That's what we're seeing with fluoride, and that's what we're seeing with vaccines as well. And this is kind of coming up on the end of my time here. But what I'll say is that I co-run a project at BU called the State Vaccine Policy Project. And what we do is track across the 50 states bills that are introduced that are either pro or anti-vaccine in focus. And what we've seen as a result of this project is that prior to the COVID-19 pandemic, most vaccine-related bills that were introduced were positive in nature. They were trying to promote or expand vaccine access. But since COVID-19, we've seen almost an equal split of bills trying to promote versus take back or roll away vaccine mandates. And the overwhelming majority of those bills that are anti-vaccine in focus are coming from the ideological right. They're coming from Republicans in state legislatures. What we're showing in a working paper that's currently under review at a scientific journal is that about 9 in 10 bills in the past 2 legislative cycles for which we have data are introduced by Republicans across the state legislature. And look, this wouldn't be a problem if those bills died and didn't go anywhere, if they didn't advance out of committee. But dozens of those bills, according to our project, have been passed into law, including bans on vaccine mandates in states like Texas that have made it harder for private employers to require their employees to get vaccinated. One super quick note before I wrap up. I don't want to only talk about the United States. I want to note that this is a global problem, and one of the primary drivers of vaccine skepticism and vaccine hesitancy across the world is vaccine misinformation. You can see up here on the slide that different regions of the world vary quite a bit with respect to how many people think vaccines are safe and effective and how many do not. Vaccine hesitancy tends to be most represented in Western Europe, in Australia, in New Zealand, and of course right here in North America. And my colleague, Chrissy Luns-Trujillo, and I have published some research showing how it is that we think we've gotten there. And we find that broadband rates, the amount of access that people have to the internet, is strongly correlated with vaccine hesitancy in both middle income and developing countries, which is essentially our way of saying the amount of access you have to vaccine-related misinformation is directly associated with how much vaccine hesitancy there is in developing and middle income countries. So this is not a US-specific problem. Vaccine misinformation is a global problem. I do not want to make it seem as if we are the only ones here, but we are quite peculiar with respect to how prevalent vaccine hesitancy is and to how much of an impact on public health and public health policy it's having. The last thing I will say before concluding is that my colleagues and I do a heck of a lot of research on trying to fix this problem. I told you all about the research we've done documenting that there is a problem, right? But it wouldn't be fair for me to say that there's something wrong and not try to make an effort to fix it. We do a lot of work trying to strategically promote vaccine uptake, and I am going to tell you about none of it tonight, because I think that Dr. Roque Gordon, who has clinical experience working with vaccine hesitant people, would be the best person to tell you about what some of those strategies are in clinical practice. Happy to talk more in Q&A, but I'm going to turn things over to the doctor now.
Thank you. How do I turn this on? Thank you. Oh, it's on? Okay. Thank you.
Yeah, thank you.
That was really dynamite. Well, hello, I'm Rosemarie Roque Gordon, and I'm going to switch gears and talk about vaccine hesitancy from the perspective of clinical practice as a practicing physician. I'm going to talk about what I consider 4 subtypes of people I've met in my practice. We'll take a little detour to talk about school requirements and exemptions. I'm going to tell you what I've done in my practice to increase uptake, and then maybe some public health initiatives. So here are the 4 subtypes. Just as Dr. Motta showed us, it's really a continuum. It's not all the same. But we'll start with the most extreme first. The least common are people who just refuse all vaccines. In my 25 years of being a pediatrician, I've only had 4 families who refused all vaccines. The majority do not. In the United States, only about 2% of children of school age are not vaccinated. So this is really uncommon, just as Dr. Motta pointed out. These families had some commonalities. They had a preference for nature, for natural, for organic things, organic clothing, breastfeeding for many, many years. They seemed to want to keep out the world. They had a distrust of medicine, but they kind of also had a distrust of a lot of things of like the modern world. They wanted to keep away what they saw as like a pernicious element in their world. Their feelings about vaccines were their lifestyle. It wasn't just about vaccines. It was the way that they were kind of conducting their life. These were very strongly held beliefs. I'd like to put this in context of a broader movement called the medical freedom movement. This is a group that really came to prominence during the pandemic in their, I would say, shared dislike of the COVID vaccine and mandates. And I think that the kind of language and passion that these people express, even in these signs, help us understand that these are not lightly held ideas. These are really like core beliefs. This is like a core shared value that when it's kind of challenged can kind of paradoxically almost make people cling more tightly to that belief because it's like a group threat. Just so as Dr. Motta was mentioning, there's some, we don't just touch on the United States here. My husband, who's back there somewhere, took these photos when he was in Poland on business last month. He happened upon a rally that was in opposition of vaccine mandates for children in Poland. And I think what's really chilling is that sign on the left, it's like a billboard with the crying baby, says, at least according to Google Translate, denazification of medicine, freedom of choice. That language is like so hot that I think we can basically see this is not an easy group to have great influence over. Let's take a minute and talk about school vaccine requirements. If this group of people is not vaccinated, what does that mean? How are they going to go to school? Some people will homeschool. I'm just putting this here so that we can sort of keep in mind that when we talk about children receiving vaccines, a lot of that is from school enrollment data. So we don't know that much about the homeschooled population, and it's growing. So I think the importance of this slide is just homeschooling is a thing. It's a trend that's increasing. It's about 3 million people. Among the homeschooled, about 50% are under-vaccinated. A much smaller percent, about 5 or 6% are unvaccinated. But that's much higher than the country overall. This kind of vaccine hesitant are much more common. I see these people at least once a month. I call them the selective refusers. They'll take some vaccines, they'll refuse other vaccines. They wouldn't call themselves anti-vaxxers, and they wouldn't call themselves anti-science. I got some examples. HPV vaccine, it's a great vaccine. It prevents cancers, is often declined. Parents will say, no, doc, I don't want that. That's a sex vaccine. Or my kid's too young. I don't want that vaccine. This vaccine, unfortunately, when it got rolled out, it kind of like got unfairly painted as being something related to sexually transmitted infections, but it's a wonderful vaccine. And I also find a common theme is that families will sometimes say, I only want the vaccines my kid has to get to go to school. I don't want anything else. So kind of flu and COVID, those are not school required. They'll often say they don't want it. I have some examples of people in my practice currently that are refusing the hepatitis B vaccine at birth, 1 month, 2 months, 4 months. This is a great vaccine that has reduced the likelihood of children developing hepatitis B from maternal transmission. And it's really curious because these families are accepting the other vaccines. There's been some, I think Dr. Motta was mentioning, like some rumors, lies on social media that are, I guess, encouraging families to reject this particular vaccine. It's my impression that the selective refusers are influenced by experts, but those are not all what we would consider mainstream experts. Some are like experts who are sort of like maybe more outside of mainstream or just rumors. That's what's influencing the selective refusers. So maybe we should talk about vaccine exemptions. Hepatitis B vaccine series is a required vaccine for kindergarten. So if people are not accepting it, like how are they going to go to school? Some people will get exemptions. So in our state, we have medical exemptions, religious exemptions. In about a third of the states, there are also philosophical exemptions. This is a map of this current school year, kindergartners in our state, and the darker purple are places where there's more vaccine exemptions among those kindergartners. In the state as a whole, it's about 1.5%, but in some places it's just kind of high. It's like 4% of kids are not getting vaccinated. Or not getting vaccinated with everything. They're receiving some exemptions. This is another slide that actually I find like more disturbing because these are kids who, this is same school year, 2024-2025 school year, kindergarteners who don't have an exemption and who are not meeting school requirements. The data, this is from the mass.gov website. It doesn't tell you exactly which vaccine they're missing, but some places, like it looks like Nantucket, we've got Franklin County, over 10%, nearly 13% in Nantucket, not fully vaccinated. I think that we can say these were kids who were babies and toddlers during the COVID pandemic. So maybe they missed out on some vaccines and maybe they're about to like catch up because that's certainly allowable. You can start school and then catch up on vaccines. But let me go backwards. The places that are dark purple where there are more vaccine exemptions, this is the vaccine exemption slide, kind of tracks a lot with the places where there's people who are, I think, intentionally not vaccinating. So this deserves more research. This is disturbing for anybody who's involved in pediatrics. Let's move on. This is a much more common group of people. These are the people I call the vaccine delayers. These are the people who are like, I want to get the vaccine, but not today because I can't have my kid have a fever tomorrow, has to go to daycare. There's also like, unfortunately, a trend among my population, all pediatric populations, where the parents prefer to only have one vaccine per visit. This was popularized by a book that came out in 2007 that really did not help the cause of vaccines. And it's not based on any science. But these families will say, like, I'm getting one today, and then we'll come back next week for another. And inevitably somebody like forgets, or there's a snowstorm or like a nor'easter, and so they end up not getting vaccinated. And then I think that really the most common are the needle phobic. And it sounds trivial, but this is a big reason. I hear this at least once a week. People are like, oh, I would get it, but my kid has, baseball tryout tomorrow, and I don't want him to have pain in his arm. Or like the kid will start crying and the parent will say, you know what, I'm gonna bring my boyfriend to the next visit and we can do the vaccines then. This seems really trivial, but it's actually a big group. I also think there are vaccine forgetters, people who say, like, I meant to get the flu vaccine, but I missed the clinic. And then these are some vaccine-specific concerns. Dr. Motta already touched on this, and I am not going to say these words out loud, but this still comes up. And I say, no, vaccines don't cause autism. People think that they can get the flu from the flu vaccine, and this is not possible. This is not possible. It's a killed vaccine. You cannot get it. And then COVID vaccine, unfortunately, lately people are saying, that's over. We don't need to worry about that anymore. It's all finished. I like to change gears quickly and just talk about things I've done in my practice that have helped me. I frame vaccines right from the get-go as part of what we do, as it's an expected part of care. And I try to normalize for parents, vaccinating is good parenting, because often parents are like really ambivalent. I don't want my kid to cry. This doesn't seem good. I also, again, this seems like a silly thing, but I review the vaccine record at every visit. So if you're there for a checkup, we talk about vaccines, but if you're there for like a sprained ankle, or we're going to talk about your atopic dermatitis, I'm also talking about vaccines, so I can capture those people who were like the vaccine delayers. I think it's important to be open about common side effects, because it's not true that there are no side effects. Everything that's a medical intervention has some side effects. And also about vaccine efficacy, because some people will say, like, I got the COVID vaccine and I got COVID. So I try to at least tell families, this is what you can expect from a vaccine. Thank you, Darlene. And then I try to respect what my families are worried about. If I don't know the answer, I say, I really don't know the answer. I'll get back to you. Should we? Yeah, that's good. Thank you, Darlene. I think it should be easy to get vaccinated, because a lot of people would get vaccinated if they didn't have a lot of hassle. So I think there should be drop-in clinics. I wish I could say that I'm in charge and I make this happen, but I don't. Of course, vaccines should be free, and maybe that's going to come into question with cuts to Medicaid and cuts to the Vaccine for Children program, which would be really dreadful, because that's a really effective way of limiting vaccines. If people have to pay for vaccines, it will not happen. And of course, we should address needle phobia. Because I'm a pediatrician, I'll just take a sideline here into a patient. This is a real person, PE, 11-year-old. She was so phobic of needles. She was like panic attack, vomit kind of fear of needles. So we scheduled a visit just for her to come in and practice, this is a syringe without a needle on it, and this is what the shot blocker will feel like. It turned out that the alcohol swab was really gag inducing for her, so we just used betadine instead. And she came in, she got her 3 vaccines. It was a win-win. She felt really good about herself. She was self-efficacy. And I think obviously in an issue that's so dependent on trust, we have to build trust with families, and that happens over time. It's not like I can get people to trust me in one day. But if you do primary care, you're seeing people day after day, year after year. And I think things that would help, I don't know, but I think that things that would help would be strengthening school vaccine requirements. We don't need new rules, we just need the ones we have to be more enforced. I think exemptions should exist for valid reasons only. It has to be a truly valid reasons. And I think there should be enforcement of daycare and preschool requirements. I think some people don't even realize there are preschool vaccine entry requirements. They're not routinely enforced. I think we could get some public health messaging out there that would help if it were like tailored to specific groups of the vaccine hesitant and really engage stakeholders. I've got a couple of things I found on the internet of initiatives that did work while I was preparing for this. One is the I Immunize initiative, other one was MS. I Immunize, I thought this was like really beautiful looking posters. These kind of remind me of the people in my practice who were the vaccine no-go people, the refusers altogether. This program was founded or spearheaded by a woman who lived in this community in Western Australia, and it was a place where a lot of people were rejecting vaccines. And you can see the guy on the left, he says, I use cloth nappies, I eat whole foods, and I immunize. And then on the right, I breastfed, I use complementary medicine, and I immunize. This is a values-based campaign. There's nothing there that's saying, like, these are bad diseases, we should vaccinate. It's just saying, vaccinating is part of our shared community, like, principle or value. It's something we do. This is another one. It's a public health initiative story. It's about a measles outbreak, but not the current one, the one from New York in 2019, and it was concentrated in the ultra-Orthodox Jewish community in Brookline in Rockland County because there had been lies spread in that community about dangers of MMR vaccine causing a lot of developmental problems in children, so people stopped vaccinating. Measles came to town, and it really took off like wildfire. Mayor Bill de Blasio declared a public health emergency, which was a very good idea, and made a good slogan, don't wait, vaccinate. And he made MMR vaccination mandatory and then had fines for unvaccinated. For some people, I'm sure this was highly motivating and changed their minds, but for some people it was the opposite, and it sort of pushed them in the other direction. And there were cases in the news of people saying, I will go to jail before I let my child be vaccinated, or I'm going to keep my children indoors until, this measles is over. That could be for 2 years. Like it had this unintended consequence of pushing some people in the other direction. So into this space came a nurse practitioner named Blima Marcus. She is a member of the ultra-Orthodox Jewish community in New York. And she created this initiative called EMES, which stands for Engaging with Medical Education with Sensitivity, which is a very kind of like clunky name. But the acronym EMES sounds like the word for trust in Hebrew. And this actually, like the I Immunize campaign, had measurable impact on improving vaccine uptake. I think it worked not because she was providing information, but because she really understood this community. She understood like how to talk to them, what tone to use, even the format. This is her with her little hands on a pamphlet, a paper pamphlet. She understood this is not a community that's like engaging with like social media or the internet. And they trusted her. She was an in-group messenger. I think I'd like to just end on our current measles outbreak, which is a tragedy, obviously, and any child dying of measles is a tragedy, but especially in the United States in 2025. I wrote this like last month and it was 800 cases, but I think we're already at 900 cases. But the small sliver of good that we can see coming from this is that it is actually making some parents, as this NPR article that I found online says, become vaccine enthusiasts. And I've actually had in my own practice an increase in people asking for early MMR vaccine and early booster. I think people are like driven now to like protect their own children because this is a real threat. In summary, I just want to say I agree with Dr. Motta. I think vaccine hesitancy is really a continuum. There are people who are truly opposed to vaccines and it is sort of a lifestyle choice and they are hard to influence. We have to better understand that population. But then there are a lot of people in the middle who are just kind of like delayers, or I would call them like the vaccine ambivalent, maybe the vaccine non-prioritizers. I think interventions that we target or that we create should really be aimed at these specific groups. They're not all the same. It's not all about like one size fits all for the vaccine hesitant. And no matter what stage people are at in their vaccine acceptance, improving trust is really essential to getting them to like hear what we want to say and getting them to kind of go our direction. Here's some of the books I read, including Dr. Motta's book on there.
Yeah, thank you.
You're welcome. Thank you. How do we turn?
Oh, thank you. Yeah. That was great.
Oh, well, thank you. That was great on you.
Do you want to get the lights?
What's that?
Do you want the lights on?
Yeah.
Oh, okay. I didn't know it was an option.
So those are two excellent talks. Thank you both very much.
Thank you.
Thank you, Peter.
Questions, comments? Yep, yes.
This is really for any of you want to comment. I'm thinking of the people that are really believe that vaccines are harmful. And is there a place for further testing or research to ensure that these vaccines are safe? And especially since, you know, things change over time, like when, I don't know, when I was a child, maybe we had 3, 4, or 5 vaccines we took, but now I think there's many, many more, and environmentally things are different, and there's just many more vaccines that are given. I don't know what the combination would be of them, and especially when you're talking about some people that may be medically compromised. I happen to have a cousin who was very, very compromised, and about 3 years ago they insisted on giving her 2 vaccines at the same time. Later on, her brother said that caused her to have a massive seizure the next day, and she really never recovered from it. I don't know if that's accurate or not, but her brother really believed it. He's not an anti-vaxxer either. He just thought that it would have been more appropriate for somebody who had severe medical issues to get 1 vaccine at a time.
Yeah.
But I just think that maybe it would help to convince the anti-vaxxers if there was more research and more testing to ensure that these vaccines are all safe.
So there are a couple of questions. One is multiple vaccines at one time, and in general, the question is, you can rephrase them. Go ahead.
Oh, sorry.
Anyway, the questions that I hear are multiple
that's on.
It's
vaccines.
not
I don't
on,
think that
my
one's
friend.
on.
Here,
Yeah.
we'll turn this one, yeah?
This one works.
This is on.
It's on
The
now.
questions, I think a couple of questions there. One of which is, how about safety in general, and are vaccines really safe? And secondly, is it safe to administer multiple vaccines at one time, right?
Well, and also
Well,
is further testing, would that maybe make the anti-vaxxers less reluctant
Right.
to believe that they are safe?
Do you mind if I
No,
take
go
this one?
Please do, please do.
I think this is such an important point, right? Because one of the things that we need to recognize about vaccine hesitancy is that most people are oh, you can't, how about now? Great. So most people are somewhere in.
You know, it's better if you speak pointing right toward us like this.
Great. Okay. Yeah, I know I've got these two. Most people are somewhere in that persuadable middle, right? They're not full out refusers, and they're not yet at the stage where they're accepting most vaccines as being safe and effective. What I'm worried about is that we could do more research on what we already know to be true, right? But it's not a matter of saying, hey, the vaccine consensus is most medical doctors believe ... vaccines are safe and effective. Like Dr. Roque said, we need to meet people where they are. We need to understand why some people are vaccine hesitant and speak to them on their own terms. We could invest more government resources in studying these questions. But one of the things I worry about is placing unnecessary procedural political hurdles in the way of getting vaccines approved. So you may have heard this week that Secretary Kennedy wants to propose placebo testing for COVID-19 booster shots. And what that essentially means is that COVID-19 shots have already gone through clinical trials. But when we update them every year to come up with the new strains that need to be addressed each year, they don't have to go through the full clinical stage, full 3-stage clinical trial process again. Kennedy wants that 3rd stage of clinical trials to be redone every single time we have a booster to show that they're safe and effective. Now, look, I like data. I'm a scientist, right? I want to be able to come up and know that the world that we see is really the world that we think that it is. But if we subject vaccines to that, I would argue, kind of cartoonishly high level of scrutiny, we are never going to have vaccines when we need them. This is something that looks like research, but isn't really quite research. So that's my worry there. I think it would be more effective for us not to overwhelm folks with data, but to instead try to make an effort to meet them where they are and speak to them on their own terms. I don't know if you wanted to add. Well, I guess you would.
Is this one on?
I think that one works
Yes.
too.
I had turned it off. Listen, I'm sorry that your friend or this relative of yours had this terrible event. I don't know if that was related to vaccines. Vaccines are safe overall, but there is no such thing as a medical intervention that doesn't have some risk. I agree with Dr. Motta, though, that I don't think the primary issue is doing more research. Millions of people, millions of children have been vaccinated with the current vaccine schedule that we have. And it is more vaccines than say 30 years ago or 40 years ago. And we should rejoice in the fact that now we can prevent rotavirus and we have better vaccine against pneumococcus. I feel really happy about the fact that we have more vaccines and we can protect people against more things. But I understand that, from a sense of burden of needles, families may say hey, this is too many. When I was a kid, we only got, 3 needles and now we're getting 17. So I don't think the answer is necessarily doing more and more and more research. I think this is a very tragic story that your family member or the friend experienced. But for the vast majority of people, multiple vaccines at one time are safe.
This was a medically compromised person. This wasn't just like a regularly healthy.
Right.
It is true.
Vaccines in one time.
It could be for example, a vaccine can cause a fever.
Yeah.
That is a known side effect. And it's possible that in this person who had medical issues, the fever led to a massive seizure. I really can't speculate, but this is a tragedy, and I'm not trying to say these aren't important things.
Right. I was more thinking of the idea of more research to convince the anti-vaxxers that this is really very all safe. Just
Right.
to address all of their possible issues.
Right. So.
Yes.
Yeah, so I come from a very different perspective. I'm a virologist. I have a PhD. I work with Novavax developing Ebola virus vaccine, flu vaccine, RSV vaccines. First of all, for new vaccines, which is what specifically Kennedy was talking about,
Yeah.
placebo trials are absolutely critical.
For the new ones, for sure.
Novavax developed an RSV vaccine
Yeah.
where the vaccine group got more cases of RSV
Yeah.
than did the placebo group.
Yeah.
That was an ADE effect.
Right.
So that vaccine was killed.
Sure.
Pfizer developed a different RSV vaccine. Their placebo group did well, or I should say did poorly compared to the vaccine group. As for the COVID-19, unfortunately, because of the way that the mRNA vaccines take years
Yeah.
to go to market,
Yeah.
the RNA vaccines are dumped to the market really fast.
Yeah.
And unfortunately, a lot of the characteristics that were originally thought about lipid nanoparticles are turning out not to be quite what they thought. I mean, there's no the distribution of the LNPs is all over the body. It was supposed to be localized. The dosage isn't controlled. Some tissues will overexpress. And so it's perfectly legitimate for some vaccines
It is,
to demand additional So what the public needs is clarification and data.
Yeah.
So
Well,
that, like polio is great because that virus doesn't change.
right,
That vaccine doesn't need to change.
right.
Flu, coronaviruses, there's a whole series of
Right.
flaviviruses. They're very variable in change, and in some cases, dengue fever is one case.
Dengue,
you can
yeah.
make people really sick
Yeah.
using a dengue fever virus because they'll get the other variant.
Yeah.
So there's a lot more
Right.
nuance to this, and you need to. So I keep hearing, there's anti-vaxxers and there's vaxxers. No, well, I'm a scientist.
No,
I look.
yeah.
I know. I see. And yet, yes, I know the bozos that you're talking about. They're like, hey, you can't have a vaccine because
Yeah.
it'll make you turn into a frog or something.
Right.
You know, there are those people out there. But I'm also seeing from your end,
Yeah.
a lot of, vaccines are good. You can get flu from a flu vaccine if you're using the activated, if you're using the attenuated.
The nasal.
No, but-
Nasal.
Most people don't use
We-
the nasal.
We don't, no, I'm talking about the injected, inactivated, not
There's
alive.
several on the market that are.
Yeah.
that
There's the
are
nasal,
available.
but,
There's
like,
inactivated,
these are not
there's
nasal.
subunit.
So-
There's also.
This is true. In my practice, we always use the inactivated, injected flu vaccine for children. We are not, you can't get the flu from that vaccine.
So there's nuance even in that.
Right.
And also, if you don't get, so when I was working at Novavax, I mean, we were in a race. We had like all the different strains making the vaccine, and we had to wait to the last minute to decide which strain we were going to make the vaccine for.
For COVID or for flu?
Flu.
For flu, I
I wasn't working there.
I see.
Yeah.
But it's really difficult, and if they get it, if they're off on their prediction,
Right.
there can be a worse outcome that year.
Well, I think it's really important to recognize that, we agree about the need for nuance, right? Like, when it comes to new vaccines, which is part of what Kennedy's talking about, 100% agree, right? These need to go through the full 3-stage clinical trial process. But for something like a COVID-19 booster, it's really interesting that Kennedy's order is exempting flu from this procedure, right?
That's because there's data to suggest.
There's data to suggest that the COVID-19 vaccine is safe too.
The mRNA booster is actually producing an immune reaction to the spike protein, which is resulting in ADE, and the individuals who are receiving multiple boosters
Right.
are becoming dependent on or more susceptible to the virus. That's where that's, and so when you do that, when you get more research and more data,
Right.
that clarifies the issue, and hopefully gets people to be less skeptical and feel more happy.
Well, and I totally agree with you that, like, people who refuse vaccines are not unreasonable, right? Like, I'm thinking about the exchange that Senator Cassidy, Senator Paul, and Robert F. Kennedy Jr. had during his testimony a couple of months ago, where Cassidy was talking about the Hep B vaccine, how important it is to make sure that kids are Hep B vaccinated. And then Senator Paul kind of interjected to say, well, wait a minute, that's a vaccine for an STD. Why are we giving young kids a vaccine, right? And so, right.
I know, I get it, yeah.
We better move
But
on
it-
to.
okay.
Right.
Sure.
Another question?
Okay.
Front here?
Well, I don't know if anyone in this room was at Coolidge Corner Theater last night for right, so you were. So there were 6 speakers, stories from Brookline. And one of the speakers had to use a walker and then a cane to get up to the stage. And all the other talks were kind of uplifting, incredible stories. And this one was half the length, and he said that he's a journalist, and he is in the position he's in, which is he can't walk, and it's already taken him years to get there, because he had a COVID-19, he is Guillain-Barré.
Yeah. Right.
All right, Guillain-Barré, yes.
Yeah, and it was triggered by the COVID-19 vaccine, and that vaccine makers, he's telling this packed house, the vaccine makers aren't liable, you can't sue the vaccine makers, they're free from liability, and he's going on and talking to all of us. It was the most frightening, and we're, pretty much of a vaccine acceptor group, and hear this, and he said, if I could call on all of you to just ask the vaccine makers to continue to develop, so that, he said there are triggers for RSV, there are triggers for, and he went through, and he said, can't, someone call on them to make sure that this doesn't happen to more people. And you did say, there are medical.
There's risk.
Yeah.
All right, I want to say Guillain-Barré is a horrible thing and ascending paralysis, but more common triggers are viruses and not vaccines, but certainly a vaccine could be related to it. I agree that some research and study should be done into this, but the vast majority of people who receive vaccines do not develop a horrible Guillain-Barré.
Yeah, he did say, he had all the numbers of the people and of all the different.
Yes.
But, it was kind of horrifying. This is how things get started. That, someone gets up, it's evident this happened to him, and to a theater full of what is 750 people or something can, be seated.
Right. Well, this is why it's so important to accept people's stories, right? Like, this is a really horrible thing that happened to this man, and we shouldn't trivialize his experience at all, right? And he's someone who came to you with numbers and data, further exemplifying this point that people who are in that hesitant middle are not crazies, right? They're not lunatics. They want to be talked to the same way that any of us want to be talked to. What I would say is that, every person who considers themselves to be a vaccine, someone who promotes vaccination, right? Whether that's policy-wise or communication-wise, we all believe, and we all know people who should not vaccinate because they have medical reasons why they shouldn't. But like Dr. Roque Gordon mentioned, that is a relatively small subset of the population. And yes, we need to continue to do research, not defund that research, right? We need to continue to do that research to figure out who those people are and what they're at risk of experiencing. But the idea that we would dismiss people on the basis of their experience is one we really, really need to shake away from. We shouldn't hit people over the head with facts and say, you're wrong, the science says this, and here's why you're wrong. We need to understand where people are coming from, and that is lost, I think, in so many of these debates.
Yes.
I was wanting to comment on the fear, needle fear.
Yes.
I myself am a candidate for that, and therefore I worked a lot on it to see how can I make that less painful, especially when I give it to children. But besides the distraction and perhaps a little type of a reward at the end of it, which at least the child associates that visit with something pleasant besides this. The second thing that I find, and I find that a lot when I go for injections to the pharmacy or to a nurse, when they clean the area with the alcohol swab, they don't wait for the area to dry.
Yeah.
When the needle goes through a wet area, that stings. Even for me as an adult, so when I go now for a shot, I literally tell them, after you clean it, please wait till it dries. Because nowadays your needles, especially in advanced countries, even in the low and middle income countries, you are getting good needles. There may be some places where it may not be, but the vast majority will get good needles. They are so sharp, they don't really hurt at all. But these minor precautions, I think, are essential. The second thing that worries me is when you have a political group involved which is anti-vaccine, we have real problems, because when we do in global health, when we go and do education, health education to the population, to promote the use of vaccines or to come and take it. You are addressing the public. Here, I think we may first have to get the group at the higher level together so that we have a uniformity. I mean, how can we convince that group that is so anti-vaccine? Because until that problem is solved, either we need some more studies, but that will take time. But I do think we have enough evidence now. COVID is a different issue. I mean, that vaccine was done in such a hurry. It had to be done, whatever the reason. So I don't think we can compare all these vaccines to COVID vaccine, because MMR vaccines have been there for a very long time. And you have enough data. And secondly, when you're comparing, we can't compare with just a placebo. It should get compared to the children who get the disease. Because between a placebo and giving a vaccine, there is going to be a little bit of complications more in the child or the group that gets the vaccine, because you're giving some medication which can have some side effects. But it's obviously far less than the disease itself, and that is what we have to keep dinning into everybody. That do you want that degree of complications that will come as a result of disease? I don't know if that makes sense.
No, it does.
It makes a lot of sense. Can I answer?
Yeah, please.
I want to say amen. I agree. I think that one of the things that we didn't talk about, but is a fact, is that there's less of an awareness. The World Health Organization says that one of the reasons that people are vaccine hesitant is complacency, meaning people are just not that worried about these diseases anymore because nobody has seen it. I haven't ever seen measles, and I've been a doctor for 25 years, so I hope I don't see it, but I think it's coming, yeah? I worked briefly, my husband and I, in Vietnam, and I saw varicella there, but I wasn't seeing varicella in the United States anymore. And so I think that we do need to remind ourselves that it's not vaccine versus nothing, it's vaccine versus tragic, horrible diseases. People actually die from measles. People can have subacute pansclerosing encephalitis and die 10 years later of a terrible death. These are really bad things that we just don't think about, but over the world overall, there's probably 100,000 people who are dying but 100,000 of measles every year. I liked your observation about the small things that can change people's minds. Like if we just allowed the alcohol swab to dry, or we just paid more attention to distraction, or like a needle blocker so that you don't feel the pain as much, I think there would be less distress and misery. Absolutely, when parents see their kids freak out, they really don't want to come back for the next vaccine. They're kind of like, I would say, like the unintentional vaccine delayers. They meant to come back for that booster, but they're not coming back, because the kid is like, I'm not. So I think those are really great observations.
I would also like to, this I'm talking from personal experience, because when I was in India and when in the private practice, I used to give the vaccines myself. I didn't even have the nurse doing it in my own personal clinic. And these simple steps made it so good that when I told them I'm leaving and going abroad because I came into global health, some children cried and said, who's going to give me my vaccine? So I think I'm not talking in just theoretical, I'm talking really from experience.
Yeah.
It does make a difference.
Yeah.
Just these little simple steps.
Jim.
I was just curious what you know about the educational basis for people's understanding of vaccination. Do people who are being vaccinated understand what's happening, what the process is, and at what level does the science get taught to the general public?
Sure. So that's a question for which we actually do have some data to weigh in here. The short answer is that most Americans don't really understand how immunization works. There's not a lot of this If that content is being taught in high school classes, it's clearly not translating to the time that people are adults. A lot of people don't understand how immunization works. But what is so interesting, and this goes back to a theme that we've talked about throughout the course of the evening, is that often it's skeptics, it's people in the middle who have kind of the most information about how these things work, precisely because if you are so motivated to want to see vaccines as unsafe, you have to build that case with facts and data in order to try to persuade other people to see the world your way. I used to teach a course on misinformation, and one of the things I used to tell my students was, if you want to know something about the curvature of the Earth or planetary geometry, ask a flat earther, because they have to know about it, right? In order to make that argument, they have to know the facts and the science. This is why it's so important to not assume that people who disagree with us are stupid, that people who disagree with us don't have information, because quite often they do. And on the other end of the spectrum, there are plenty of people who vaccinate who have no idea, right, how basic immunity works, right? So I think it's really important to recognize that there is kind of a knowledge gap there. Will knowledge fix all of our problems? Probably not, because it doesn't overcome that motivational barrier. Some people want to see the world in a particular way, and all the knowledge in the world isn't going to change if that motivation isn't also changed. So when we, as people who promote vaccination, when we think about encounters, we need to think not about just telling people you're wrong and here's why. We need to try to convince people to want to vaccinate, and that's so much of what you do in the clinic, and that's what we try to design in the laboratory as well.
Yes.
So, people my age remember polio and how frightening it was and how wonderful it was when the vaccine was developed. And you don't see it anymore. But you may know that Rotary International's biggest global project is polio eradication.
Yeah.
And I took part of that in an immunization campaign in Africa some years ago. We met with the Minister of Health, we met with the Council of Muslim Imams, who have a lot to say about education in the country. They were on our side, and they publicized the need for polio immunization. So it's being done by a consortium involving Rotary International, the Gates Foundation, which has given us $2 billion to match the $1 billion we've raised so far. The World Health Organization, which our government has withdrawn from for reasons I can't understand at all. The CDC, which is part of our own government, and UNICEF. And we're talking about the United States leaving the United Nations. So my question is, do any of you know about whether the drive to eradicate polio has continued, or whether what our own government has done to withdraw resources is impeding it and leading to more people getting polio? Because it was almost eradicated a few years ago, and I don't know what the current status is.
I don't know the answer.
Yeah.
Do you know that answer?
Well, so I have a few friends who do work in this area, and my understanding is that, so something like withdrawing from the World Health Organization, the ramifications of that are going to take years to see. I don't know to what degree those specific projects on the ground are going to be impeded in any way. I do know the Gates Foundation is ramping up its investment, right, to try to offset some of these losses. So my hope is that ultimately these efforts are unimpeded, but it really does hurt to lose such a major international partner in the United States. And just from my conversations with folks in WHO, I mean, it seems like they're kind of reeling right now, trying to figure out what to do. So I wouldn't be surprised if, unfortunately, that ends up being the case.
I don't really even understand how one person has the power to do that. Isn't it up to our Congress, who appropriated all that money?
Oh, yeah, do we get to talk about the Impoundment Control Act? Because I would love nothing more than to talk about, just really briefly, the idea that for some of these actions that the Trump administration has taken, some of these actions are a violation of the Impoundment Control Act passed in the post-Nixon era, which is essentially a stipulation that if Congress spends money, the executive branch has to spend it. This was the source of debate between Representative DeLauro from Connecticut and Kennedy under oath last week, where DeLauro kept saying, hey, we've appropriated money and you're not spending it in the form of canceled grants. You're not spending it in the form of firings, right? Canceled grants, firings, these are all violations of impoundment. Kennedy said, again under oath, and I have no reason not to take him at his word because he's under oath, said that he was not aware that these things were happening. It's scary to me if the head of HHS does not know about these major things that are happening under his watch. But if he does know that they're happening, these are illegal actions. Now, when it comes to withdrawing from the World Health Organization, if what you're doing is not spending money that the Congress has allocated, that's a violation of impoundment control. But we also have to grapple with the fact that the president is a very powerful person, right? There are a lot of things that the president can do legally through executive action. He can't choose not to spend, for example. But there are amendments, for example, he can make to the Affordable Care Act that can be done through executive action. So we do need to understand that who's in the White House also matters. And right now, that is someone who does not share the vision that the Rotary does.
I wanted to say about the polio eradication campaign that it was kind of hurt a little bit by a connection with some like political forces, and I do think that was a mistake, and you probably could speak more to this, but there was some truth that there people who were pretending or maybe sort of going out and vaccinated with polio were also kind of gathering intel to find Osama bin Laden.
Right. They were like arresting people, if I recall correctly. So this was an actual plant.
So it was, it created distrust. It created distrust among the people, on the ground. And this has led to that really horrible thing of vaccinators, just like average, ordinary people in those countries being killed. So, some bad things went down. That was part of like U.S. government stuff. Not that we would agree with that, but it shouldn't have involved. It shouldn't have involved vaccines. And I wanted to say I was so happy that you mentioned that when you were in those countries, you were gathering like the imams and the community leaders, because that is how you get vaccine acceptance. You don't get vaccine acceptance because you're like, we have a vaccine, we want you to take it. People are very suspicious of that, understandably. So I think it was really brilliant that your campaign was involving trusted leaders, trusted religious leaders, like authorities that had more like, value or more buy-in from the population.
Well, as I understand it, the resistance wasn't crazy. There was a rumor that the vaccine was campaigned by the West to sterilize Muslim girls.
Yes, I think.
I was in a Muslim country. They had reasons to be suspicious. My understanding was that it was an American company that tested a meningitis vaccine without proper authorization from patients.
And cause some harm, or just try it?
Well, they did it without legal permission.
That
caused mistrust among the population.
That's horrible.
That's really horrible, and that theme of vaccines causing sterility intentionally, it's not only a theme really, this is not true, but this is a rumor that touches the HPV vaccine, like really curious, really bizarre, but in different countries, that rumor has appeared over and over again. It just shows us the importance that there needs to be community buy-in. You need to have like stakeholders on the ground so that these rumors don't take hold, because they're really harmful.
Richard?
A comment, and maybe you can respond to a question. The comment is, I guess, that you haven't said what the implications are of the COVID-19 from a positive standpoint. How many lives were saved, as well as with other vaccines, like touched upon measles, but what that might mean, polio, COVID, measles. My question goes to an earlier comment you made in the slide that said, this goes back to the point about the presidential's powers versus who's making decisions. You were saying, Dr. Motta, that it's the states.
Mhm.
Why can't, I'm concerned that
Yeah.
who knows where HHS, CDC is going in terms of vaccine approvals.
Yeah.
Is it possible that that they may say, need more testing for measles vaccine?
Yeah.
Or I thought there was some suggestion that we might not have COVID-19 boosters in the fall. For those of
Right.
us who want them.
Right. So here's kind of what Secretary Kennedy can and can't do. When it comes to states determining what vaccines are required for entering public schools, I mean, that is something that falls under their Amendment 10 constitutional protections. When it comes to the approval process, Kennedy does have a lot of legal discretion here. And so one of the things that he can do, which we've talked about a little bit tonight, is place what some people might say is necessary testing, what others might say is procedural hurdles in the way of getting vaccines approved. And like we've discussed tonight, right now, Secretary Kennedy wants to focus on new vaccines. And of course, the question is, well, what counts as a new vaccine? Is a booster a new vaccine? And that's the fight that we're having right now. I think it is quite likely that what we're going to see happen is throughout the health bureaucracy, an effort to replace career scientists and civil servants with people who are political appointees. And so the people who are in those positions, whatever those definitions end up being, whether we agree with them or not, are going to be people who are making those decisions on the basis of politics and not necessarily science. We know that this is happening because right now there is a proposed regulatory rule change to implement what you may have heard about recently as Schedule F classifications for folks who work in the civil service. And essentially what this means is that if you work in the health bureaucracy, if you work in HHS, if you work in the CDC, FDA, wherever, and you hold opinions that the Trump administration deems ideologically non-congenial to what they want to happen in the executive government, that can be grounds for firing them. And those people can be replaced with people who are more ideologically amenable to the Trump administration. So I do share your concerns that yes, Kennedy can't change what Massachusetts does when it comes to polio vaccination. But when it comes to new vaccines that may come on the market, he may make it more difficult for those things to come online quickly. And that could have real consequences for people.
I wanted to add that you're right. Like, we forgot to say that vaccines are a public health miracle, and they've really changed the way that we live. They've made people able to live long lives. I think it's that we're complacent too, because we're so used to how successful they are that we don't focus on that amazingness, and instead we spend a lot of time talking about the unfortunate, tragic, but rare risks and side effects. Like, those do exist, and people can have a horrible allergic reaction to them. But yes, vaccines have been a public health marvel for the world.
Yes.
What would be your suggestion as to how we should proceed when you have half of the government itself being anti-vaccine? Because that I feel is your biggest problem. That if you have the support of the government, then it is the way you give the health education, how you go and talk to them, may help solve situations, as it has done in the low and middle income countries. But what would be your recommendation when you have half the political group, which is, and then is there a way we can find out why are they anti-vaccine? I mean, what is it? The autism thing, of course, was a sad thing. That study should have never been there. But what would be your suggestion? How do you convince them?
I think that vaccines and health need to be taken away from political sides. And I think, as Dr. Motta pointed out, during the pandemic, it really did become about sides. It almost felt like people were unthinkingly moving towards what people, in their team, if you felt that you were more like a Republican or more like a Democrat, you just found yourself sorting in with those beliefs. It was more of like a tribe or something. And I found that when I had patients who were true vaccine refusers, maybe trying to challenge them made them push harder to say no. So people who are strongly identifying, with one group or the other are going to sometimes reject things that try to, challenge those beliefs. So I think it would be great if vaccines could just be removed from politics entirely, and I don't know how to do that. I really don't.
Well, that's one of the things that we study in my lab is how can we try to depoliticize vaccines. And when it comes to the general public, right? So there's kind of two classes of people we can think about here. We can think about the general public. We can think about policymakers in Washington or in Beacon Hill, wherever the case may be. And when it comes to the general public, I think the absolute best thing that we can do is get champions for vaccination on the team that we might expect to not be in favor of vaccinating. Someone like Senator Cassidy from Louisiana, who is going to bat for vaccination under oath. Ultimately, yes, he votes to confirm Kennedy, but he does go to bat for Hep B vaccination. He went to bat for COVID-19 vaccination under oath last week. Those voices, when we aggregate them and present them to people, help people come to the conclusion that, well, wait a minute, my team might not be right on everything. My team might not be so dogmatic about this issue because people who I like and respect actually hold opinions that are at odds with the mainstream consensus. That's a really powerful way to do this. But when it comes to the elites, which I think was kind of at the heart of your question, how do we change the government in Washington to change their minds? This is a more cynical answer. This is one that I think has to do with aligning incentives. This is somewhere where we have to work with Secretary Kennedy, whether we like it or not, and not against him. And one of the ways in which we can do that is by highlighting the link between vaccines and some of the goals that he wants to accomplish in his role as Health and Human Services Secretary. We can talk, for example, about the link between preventing vaccine-preventable diseases and long-term or chronic illnesses, right? Those two goals can potentially come together in service of what it is that Kennedy wants to do. You asked where the motivations come from to be anti-vaccine. That's something that we unpack a little bit in our research when it comes to the public. But when it comes to elites, I think a lot of it has to do with political opportunity. When our elected officials see us sending them signals that it's not just okay to attack vaccines, that we actually reward them at the polls when they do so, they're going to keep doing it. And so it's really important for us to send a different signal if we want that to change, because otherwise they're going to keep doing what gets them elected. And that's why we have events like this one, to talk about how it is that we can get people to be champions for vaccinating. It's the only way you're going to get them to change.
Yep. Well, first of all, hi, Mom.
Yeah.
If you encounter someone in your practice who is a vaccine delayer, as you said, I'll just wait a few years on Hep B first. What do you do in that situation? Do you just like acquiesce, or how do you fight against that? Because you don't want to just say, oh no, you have to get it now, because you're just risking sort of pushing them farther in the wrong direction. How do you fight that?
Thank you, darling. I try to see where they are in their resistance. If they, sometimes I try to make deals with people. Like I'll say, what about we start that today, that vaccine, that Hep B series? They came in for something else, like gastroesophageal reflux, or like the baby's fussy, or there's a diaper rash. I'll say, hey, what if we start that today? We'll just do that one today. How do you feel about that today? So I feel like I bring it up a lot, but I never make people feel backed into a corner. I want us to keep the relationship going, because for me, I'm in it for the long game. I'm a pediatrician. So I may see these people for 2 decades, and I don't want to have a confrontational relationship with these families. I want them to feel that I want what they want, which is the best health for their child. And if they're really resistant, I say, okay, we'll talk about it next time. That's really what I do.
Yes.
Yeah. Let me try to articulate a question. The problems we're talking about are political problems, right? And in a certain sense, we're dealing with a cult. I'm sorry, I didn't use that word. In the sense that all of the rational arguments that you make to them sort of roll off their backs, because they, committed to this social organization that I'm calling a cult. And if you say, well, here are the facts, and person may not understand it, but their thinking is, well, I may not understand it, but I'm sure, Robert Kennedy or whoever understands it. And if I don't go along with that, I lose my position in the cult. And the problem, the political problem we're having is that there's no answer from a political alternative point of view. And I'm talking about my party, Democratic Party, quiet, sitting in a corner, and no one is out there presenting an alternative way of looking at these issues and many others. And therefore people think, well, they're not saying that this is wrong, so it must be right.
Right.
And sort of build upon the sort of cult issue. I don't know if I'm asking you to answer a question so much as just, I think that you're not speaking to the real problem that we're having right now.
Right.
And that is the political reality that we don't have any alternatives to, the Robert Kennedy way of looking at, health issues.
Well, I think you're absolutely right. One of the things that Dr. Roque made clear is that we all belong to different teams, right? I'm a huge Celtics fan. Also I have a partisan team, right? I belong to a university. Lots of different identities that sort us into different camps. And when our team tells us that we're wrong sometimes, that is the absolute best way to get someone to change their mind. I watch every Celtics game, and I believe that Derek White has never committed a foul in any game that he's played. But when my friend, I went to go watch Celtics game with my friend, and she used to play basketball, and she said, look, I know basketball. I'm a fellow Celtics fan. Derek White committed a foul there. I was willing to change my mind, not because of her basketball expertise, but because she's a Celtics fan. Right? She's someone who belonged to my team. The Senator Cassidys of the world are the types of people who are going to be the most effective at convincing folks on the right to go to bat for vaccination. I agree that it's frustrating that there is not an alternative, right? There's not a very clear alternative coming from the other side. But there are ways that we can work with what we've got to try to get people to vaccinate. And I think it's really important to try to elevate those exchanges like the one that Cassidy and Kennedy had, during. And of course, I know that Cassidy ended up voting for Kennedy, right? But there are ways that we're going to be able to take Cassidy's comments and say, irrespective of what he did for his political career, here's what he thinks about vaccines, and here's why you should too. That to me is the way we do this. I think we may be out of time.
Okay, good. Thank you very much, everybody.
Oh. Thank you.
Thank you. Thank you for coming.
That was fun.
That was really fun. I feel like we could tag team. Like we have a lot of.
That's right.
Yeah.